Got to be the change you want to see. Sometimes that just means living your life the best that you can, but we all can be an example. I want to thank Dr. Antonio Webb, who is joining me via Zoom today, orthopedic spine surgeon, also author and motivational speaker. Thank you for joining us today.
Yeah, thank you for having me. I appreciate it.
So you are traveling now, just trying to go to as many places as you can and also motivate folks to get the vaccine for COVID-19, because the more people are vaccinated, the closer we get, I know, to herd immunity. And it has been said, same thing happening here in Wave Country in Kentucky and Indiana, that there are populations that just are leery. They're not comfortable taking the vaccine. They don't feel comfortable taking a medication, especially maybe from a doctor they don't know. Can you address that a little bit, especially when it comes to the African American community? Because I think a lot of people don't know what that history is.
Yeah, absolutely. So the history goes back way back to the 1800s, where they were sterilizing women of color without their consent. And then kind of fast forwarding to the 1930s, everyone talks about the Tuskegee Trials. You know, there's a lot of mistrust. There's a lot of people that are very hesitant, especially in the African American community. The problem is that African Americans are disproportionately being affected. They're dying as well as contracted in COVID-19, sometimes 2 to 3 times higher than other races. So I think it's very critical that the message gets out that people should really take this serious and consider taking the vaccine.
When you talk about the Tuskegee Trials, and again, I'm really amazed that a lot of people just don't know about this. And again, I guess if it didn't affect you or maybe people that look like you, why would you know about it? But they actually were, did they give the men syphilis, or they were supposed to be treating the men of syphilis? Explain that trial.
Yeah, so this was a kind of a study by the National Health Service that African-American men with syphilis, these individuals were told that they had bad blood. And then they were not informed of their options at that point. And even when penicillin became available, these individuals were not, made or given access to those medications. And they were kind of barred from any type of opportunities to receive treatment. So it was more of an experimental thing on African Americans, where they wanted to see what the disease process would look like if left untreated. And this kind of has went on over the last number of years, and kind of in multiple other kind of stories about African Americans and then the medical system and that distrust, and it kind of stems from that.
Yeah, and that disease does terrible things to you. I mean, just absolutely terrible things. And so to know that there was a treatment for it, but they were like, no, we can't treat them. Let's see what happens. I recently, I had kidney cancer just a few years ago, and I just couldn't get anybody to hear what I was saying. I was not well. And I kept going to doctor. And one of the doctors looked at me and said, as an African American and as a woman, not just an African American woman, you are more likely to be put off or not listened to for that reason. And I'm like, hold up, this is 2000 something, and you're telling me that? What are we doing? Why is that?
Yeah, so there's a lack of African Americans as well as minorities in medicine. And specifically in my field, less than 2% of orthopedic surgeons are African American. And then it's even less than that for spine surgeons. I would probably say around 1%. So there's lots of health disparities. There's the implicit bias that occurs. Yes, African Americans are less likely to receive kidney transplants, lung transplants, knee replacements, hip replacements in the field of orthopedic surgery. So there's a huge disparity. There's a recent study that showed that there are less Black men in medical school in 2014 than there were in 1978. So there's a huge need. That's why I'm so passionate about ensuring individuals from communities like mine see someone who looks like them, because I'm a firm believer in that you can't become something that you can't see.
Yeah, and also all of us, especially if you're poor, if you're a minority, if you're a woman, you've got to advocate for yourself. You've got to be that person that steps up for yourself. So how did you get to where you were? And I know that you're pretty open about your life. You lost many people to violence, to gun violence, to drug use. Even your own mother was in jail for some time and ended up with an injury that affected her for life. How did you get where you are? And share some of that story.
Yeah, so I grew up a really challenging background, Shreveport, Louisiana, where several of my family members went to prison, including my little brother. My little sister did time in prison. And ever since I've been young, my mom has been on and off drugs, in and out of jail my whole life. She was actually shot, and she's paralyzed from her waist down due to her drug addiction. And for me, it was a medical careers magnet program that I went to that exposed the field of medicine to me. And it's because of that program is the reason why I'm a doctor today. I had never saw a Black doctor growing up, never had met one. And just that program kind of introduced the field of medicine to me. I joined the Air Force. That was my ticket out of that environment at age 17 and did 8 years in the military, went to Iraq in 2005, and then had a pretty rough trajectory to getting into medical school. It took me 3 times. Every single school that I applied to for 3 years rejected me. But, you know, just never gave up and kept working towards my goal of becoming a physician. And after 14 years of training, I'm finally done and now in practice here in San Antonio, Texas.
When you go around and young people see you, because you also do motivational speaking, what's the message that you want everyone to take away from where you are and what you've done?
I usually tell them to don't let their environment or their circumstances kind of dictate their future. You know, a lot of people don't have role models that they can look up to, and whether that's a mother figure or a father figure or, you know, big brother, little brother, I tell them that they can look at me, and if I can go through all of everything that I've went through to get to this point, you know, they can also. And I also try to stress the importance of failure. One of my professors in medical school stated that failure is not in the falling down, it's in the failure to get back up and try again. And throughout my whole life, that's just something that I just kind of follow, and I have gone by that philosophy my whole life.
Where'd the motivational speaker part of you come from? Did you know that was in you? Did you know, I got this, I want to go talk to folks? Or did it end up just happening because of where you found yourself?
Yeah, just kind of happening over the years. I wrote a book called Overcoming the Odds, and that book came out and got a lot of requests from schools kind of all over the country. And then my documentary, which will be coming out next week. I've been doing screenings for the last 2 weeks or so. I'm doing a 20-city virtual tour, so just stopping and kind of sharing my story with schools and organizations all over the world.
Now, overcomingtheoddsmovie.com, the world is just, oh my goodness, so different right now. Do we go there in order to see the documentary, or how can we see it? How can we share it?
Yeah, so the documentary is free. I didn't want to charge. I want to make sure that, you know, kids from communities like mine and everyone has access to it. So it will be on my YouTube page, but overcomingtheoddsmovie.com, it will have the link to it. February 22nd is the release, and I'm actually just doing some more virtual kind of pre-screenings prior to that. But yes, overcomingtheoddsmovie.com, that's where you can go to see it next week.
How is that movie done? Is it specifically done with you, or do they have people that are playing the part that you are? How is that?
It's a combination. I'm in it. I had my middle school principal who tells a story about the time kind of growing up in Shreveport, and my father is in it. So it's a really inspiring story, and I'm just really happy to kind of let the world kind of hear my story and hopefully inspire a young kid that is in a similar community as the one I grew up in, and hopefully inspires that person to reach their goals.
I'm tickled. You talk about your middle school teacher being in there. What do your teachers say now? Were you always a good student?
For the most part, I've always excelled academically. I just started hanging out with the wrong crowd, and I'm pretty sure if I would have stayed in Shreveport, after or not joining the military, I'm pretty sure I would be either dead or in jail. So, the military was my ticket and way out of Shreveport. And but from an academic standpoint, I've always done well academically.
We're going to talk a little more about the COVID-19 vaccine because you're coming back with us for another segment. But I'm going to tell you, I got COVID-19. I did everything I could not to get it, but, it's out there, and I did. And I can remember, because I have so many illnesses, I had to get the monoclonal antibody of Eli Lilly, the BAM infusion. And I can remember not wanting to go in. The nurses were saying, come in, we have to start this infusion. I was like, no, I can't, I have COVID. But that's what you all do. I mean, you even went to treat people to fight Ebola. Like, where does that come from? Most of us are gonna run the other way. But you all as doctors, I mean, many doctors and physicians and nurses have gotten COVID. Where does that come from?
Yeah, so I've actually received both vaccines, didn't have any side effects. The only side effect that I had was a sore arm, kind of on both doses. But going back to the Ebola, I was actually there in Liberia right before the Ebola outbreak. I was a fourth-year medical student doing surgery there. And, a few weeks after I got back into country, I was there for a month. Several of the physicians that I worked with passed away from Ebola. So it was just reminds me, this is very somewhat similar to what's going on now in the pandemic. It's just the patients that had Ebola, those patients were quarantined a lot quicker because they have more symptoms. And most patients with COVID-19 or SARS-CoV-2 are asymptomatic, which means they don't have any symptoms. So it's more easily transmittable. So those are the biggest things that I have seen in terms of the differences, and also the infrastructure. In Liberia, it's one of the most impoverished places I've ever been in my life. They don't have the infrastructure and the things that we have here to kind of combat, this virus.
Yeah, I mean, I'd like to think I would stay there and be helpful and all of that. I just don't know where you all get that mindset to stand smack in the middle of danger and know that it's there, because most folks just don't have the heart to do that. For all the physicians, doctors, nurses, and everybody that deals with that, we thank you all so very much. We're going to take a quick break, and then we're going to come back with more from Dr. Antonio Webb. We'll talk to him about COVID-19 and many other things, so stay with us.